When you look for a doctor, chances are you'll check out where they went to school, whether they're certified. But did you ever think to ask about their religion? It may sound like a bit of an awkward question, but more doctors are incorporating their faith into their private medical practices, and it turns out that could affect your treatment. Dr. McGee joins us tonight. He's a bioethicist at Albany Medical College. Always good to have you with us. You know, in many ways, this actually sounds like it could be a great fit for doctors and patients as long as the practice is up front. Everybody knows where they stand. So is there a problem with this at all ethically?
Well, I mean, to start with, I agree with you, Erica. This is a religious country. We're one of the most religious countries in the world. It's not surprising and maybe not such a terrible thing that lots of physicians would say, hey, guess what? I have a faith commitment, and it affects the way I practice medicine. The ethical issue happens when the way you practice medicine changes dramatically, say, far outside the confines of ordinary medical practice.
And it seems right now, as we talk about this trend, give us an idea, first of all, of how prevalent it is across the country.
Well, I don't think it's prevalent yet across the country to see clinics spring up. I mean, in the last couple of days, big news about clinics, a couple of them in different parts of the country that have literally thrown up a sign with a crucifix on it and said, if you come here, we won't talk to you about contraception. You'll never hear the word in vitro fertilization or test tube baby. We won't say things about blood transfusions. I don't think we'll see so much of that, or at least not in the next few years. What is springing up literally everywhere is the presence of objections. So pharmacists are saying, we won't give you extra contraceptives or Plan B for abortion. Nurses are saying, I'm not willing to work in different kinds of units. And so it's just natural that some physicians would begin to say, you know what, I'm not going to treat patients who want a contraceptive. Or, and this is the piece that really scares me, I'm not going to tell you about this medical option you may need to know.
And therein could lie the problem, because as we said earlier, if this is a private practice where they make those beliefs known, and it does seem that a lot of these practices are really geared toward dealing with different attitudes toward family planning. So if they make that obvious, then that should be fine. But if you do run into the situation where all of a sudden, let's say you're a woman and you're at the doctor and you ask for contraception, and out of nowhere your doctor says, I'm sorry, I can't give you a prescription for that because I don't agree with it morally, what do you do?
Well, I think if that happens to you, you find out that you're a little bit too far upstream. So there's two pieces here. The first part is it's very, very important these days to ask people about whether or not they have beliefs where you've got really strong ones. So you don't want to be 2 and 3 and 5 years into a relationship with your obstetrician and ask them for the very first time, hey, how do you feel about terminating if we have too many fetuses in my uterus, or how do you feel about my wanting an abortion? That's too late. The time to ask those questions is early. What's terrifying to me is that supply is following demand here. There are lots and lots of families out there who are saying, I don't want to hear about contraception, and I don't want you to tell my daughter either. So the effect of that is that, well, you get people who are 14 and 15 and 16 years of age. The law recognizes their right to hear about certain things, and they just don't.
Now, how do you bring up that conversation with your doctor, either as a parent or as a patient yourself, to make sure that you're seeing someone who
now, your Storm Tracker forecast with Chief Meteorologist Steve
Interviewing a doctor is not like interviewing a lawyer or an accountant. Doctors see you naked. Doctors have you when you're most vulnerable. There is no one in our society, in the world, literally, that we trust more as a stranger than a physician. It's very, very difficult to come into a doctor's office and say, hey, I know I don't know you, but how do you feel about these issues? Right, exactly. So I think it's going to be very hard for people, but it's a new time. Medicine today is very much like a consumer practice. In an era when you can go to the mall and get a 3D picture of your pregnancy, I don't think you have to be as scared about starting your relationship with the question, I feel like I'd like to regulate my sexual life. I'm not ready to have a child. How do you feel about this? And what if there were an emergency? How would you feel about that? What would you tell my children? When would you allow them to have secrets? These are things to ask up front before you say, yeah, that's my doctor.
Some great questions for us all to ask, and so interesting because, as you said, medicine is changing these days, and things that you never would have thought of probably 5 years ago now so important for you to ask your doctor. McGee, always good to have you with us. Thanks again.
Good to see you, Erica.
Well, no matter what your religion, finding a doctor you're comfortable with and one that you can trust really is key in that relationship. So you can just imagine what thousands of women in California must be feeling tonight after they learned the hospital where they got their mammograms was knowingly using a faulty machine for their tests. We're talking false positives, false negatives, consequences that could be life-changing.